these are places where you can not only be, if you don't have isolation at home, but if you are mid-level symptoms, you can go, and all of our hospitals have established these facilities, quarantine facilities, in hotels or guest houses next to our hospital, where you will be monitored real time on a daily basis. If by perchance things deteriorate, we can always bring you into our hospital. That way, the channel is clear that you do not seek a hospital admission if it is not necessary or out of panic. Let the doctor guide you where you belong according to all the questionnaires that you have answered. So then if those are people who have drop in oxygen, the CT scan is showing high score, or we all feel that, look, and all the doctors have the protocols, that according to the protocol, we feel that you have to be admitted, only then you should be brought into the hospital. So I would like to at this point say, there are certain things in behavior pattern which we must do. So you've already been warned about wearing a mask and isolating yourself if you develop symptoms. Then if you are given medicines, you access them from your closest chemist, or there are facilities today for home delivery, where in the package, we can deliver you the appropriate medicines. And if you don't have a pulse oximeter, that can be given to you, and all the directions of how to manage yourself, how much to exercise, how much nutrition you need. All that advice will help you to recover rapidly at home or in the quarantine center. So very few percent will require hospitalization. And as you realize, there is a responsibility that hospital beds are always not available, and there is a constraint. So we must utilize those hospital beds judiciously and with responsibility, and that responsibility rests on all of us, the citizens, the doctors, the hospital providers, and then, of course, intensive care unit for those very few people who may need to go to. But today you must feel comfortable with the fact that you will have a very high chance that you'll get cured. So don't panic and don't have so much anxiety that you get confused on the pathway that you have to follow. That is one part. The other part is that we are fortunately in India, where our pharmaceutical industry has come a long way in helping with this fight. They have ramped up their facilities. They have made connections from overseas companies to bring the medicines to India, manufacture them in India. So you take medicines like Faviflu, you take Remdesivir, you take some of the other vitamins and all that you need, we prescribe. All those have been manufactured in India in enough quantity. Now, you may have heard there was a shortage of Remdesivir available. So I want to address the fact, when do you need Remdesivir? We have now made a protocol that Remdesivir is to be given not to everybody who will test positive. And that misconception I would like to take out of people's mind. Only the doctor will look at a set of test results and a set of symptoms which show that a person is experiencing a viral load which is giving them high fever. They are vulnerable population, like people who have liver disease, who have kidney disease, people who are on chemotherapy but from cancer, highly diabetics, obese people. People who have BMI greater than 35 are the ones who are most vulnerable. And people who are showing signs of cough, fever, which is not responsive to other medicines. So in the first few days of the illness, if the doctor feels appropriate, only then Remdesivir is to be given, and not to be given to everybody. It is not a Ramban, and it is only effective in decreasing the viral load in the people who need it. Having said that, then we know that there will be other treatments like cortisone if you enter the phase of cytokine response. This is the response of the body to fight the virus and the protein, and there are prescribed medicines for that, and that they are also based on certain tests which will be prescribed by the doctor. So those blood tests will tell us if there is inflammation in the body, and the chest HRCT, that is the chest CT, will also tell us if there is enough inflammation that it justifies use steroids and other drugs. So majority, I mean the vast majority, will be treated and will recover rapidly over a period of time. So that's the way to go. So if all this is being done and your oxygen level is falling and not responding to oxygen, and the doctor feels that it's time to come into the hospital, they'll advise you to come into the hospital. So that's the other part I would like to say, that in any country, any part of the world, there is X amount of oxygen available as a product as production. Today, we have enough oxygen if we try to use it judiciously. We don't want to waste oxygen. So the protocols for oxygen use and the response to what level we want the oxygenation in a patient to be, and the fact that I would like to inform the public also that if you don't need it, don't use it just for a security blanket. If you are not using it and you are walking around or eating or something, switch off the oxygen. We are giving the same advisory to doctors and to hospitals also, that judicious use of oxygen most definitely should be done, and any patient who needs it should get it. So wastage will only lead to depriving some people of oxygen, which you should be, as individuals, as citizens, have a collective responsibility, that we do not want to get into that stage where we feel responsible for being selfish in wasting something and depriving somebody else. So having given you that, there is good hope, but masking, of course, is your first duty. Wear it, distance yourself, and hand hygiene is every citizen's responsibility and the first line of defense and the most effective way of preventing the virus from spreading. So the beds situation in India, a lot of expansion of capacity has been done in the last year. Also more capacity is to be added. But what I would like to communicate is, and appeal to people is, don't rush to the hospital just because you have tested positive. You will be taken care of or will be given beds if everybody participates responsibly in this and the doctor prescribes that, yes, it's time to bring you into the hospital. Same advice we are giving to all our doctors also, to take care of patients properly. When they need it, only then advise that they should come into the hospital. There is no such thing as preventive hospitalization. We should not do that. There is always a limited capacity, but we will cope. You will appreciate that for the over last 15 months, the medical community, the health line workers, the frontline workers, we are all standing, fighting together this whole unfortunate event that has happened. And we need your help in reducing the burden, and we can do a much better job for you. So with that, thank you for listening to my communication, and I'll hand it over to Dr. Guleria, who will add to whatever things that needs to be done in addition, and give an overview of what the population, potential patients, and doctors and hospitals need to do. Thank you for your attention, and over to Dr. Guleria, please.